Good morning, everybody. I wanted to make one announcement before we get started, which is that next week for the research symposium, Grand Rounds is not in this location. So I'm sure half of you are going to show up here next Monday and you're not going to find anybody, because we're going to have our visiting professor next week, who is going to be Carla Pugh, and our annual research symposium over in the Hensel Phelps auditorium. I think we're probably in the West auditorium. Remember, there's two. There's a West and an East side. So the West side at Hensel Phelps next week. So go there instead of coming here. This week, we have another distinguished visiting professor. I'm going to let Dr. Cameron Gibson introduce the visiting professor. I rise just to acknowledge that this visiting professorship is being supported by the James Fox Memorial Fund. And most of you are probably not familiar with Dr. Fox. He was a resident here in the 1960s. He graduated from Dartmouth Medical School in 1966 and then came here to Denver and was a resident for 3 years from 66 to 69. And then he was drafted in 1969 during the Vietnam War. He went to Thailand and spent a few months there before he fell ill and came back to Denver, where he was diagnosed with a malignancy. And unfortunately, he passed away in 1970 at the age of 28. His co-residents at the time then started a memorial fund, raised money, and established an endowment in his name. And we have used his endowment to fund visiting professors. Dr. Tarpley has actually been a Fox visiting professorship in the past, and so he's a repeat performer. And with that, let me hand the microphone over to Dr. Gibson.
Good morning, everyone. On behalf of the Department of Surgery and the Office of Global Surgery, it is my honor to introduce today's Grand Round speaker, Dr. John Tarpley. Dr. Tarpley is Emeritus Professor of Surgery and Anesthesia at Vanderbilt University, where he has spent the better part of 6 decades, first as a student, then as a trainee, and ultimately as one of the institution's most decorated surgical educators. He completed both his undergrad and medical training at Vanderbilt, went on to surgical residency at Johns Hopkins, and then spent 2 formative years at the National Cancer Institute's surgery branch, a breadth of early training that foreshadowed the extraordinary range of his career. From 1978 to 1993, Dr. Tarpley served as a surgeon at the Baptist Medical Center in Ogbomoso, Nigeria, 15 years directing surgical care and training at a tertiary mission hospital, helping establish a nursing school and building the kind of durable institutional capacity that defines meaningful global health work. He returned to Nashville in 1993 to join the Vanderbilt Department of Surgery and the VA Tennessee Valley Healthcare System, where he directed the general surgery residency program for nearly 2 decades. His contributions to surgical education are substantial. He was instrumental in establishing the first ACGME-approved international rotation for general surgery residents, embedding global health experience directly into the formal training pipeline. His teaching has been recognized with the ACGME's Parker J. Palmer Courage to Teach Award and the Pfizer ACS Award for Surgical Volunteerism, among many others. He has served as president of both the Association of Program Directors in Surgery and the Association of VA Surgeons, and holds membership in the American College of Surgeons, the American Surgical Association, and the West African College of Surgeons. Since his retirement from Vanderbilt in 2016, Dr. Tarpley has continued active work in surgical capacity strengthening in Kenya, Rwanda, and Botswana through his affiliation with the Vanderbilt Institute for Global Health. After Grand Rounds, he'll join us for the first annual Global Health Forum here at the University of Colorado, where his global experience will no doubt take center stage. The series of events for the day are up there, and you can scan the QR code to get the digital program. Dr. Tarpley has operated on 3 continents, trained generations of surgeons, and built programs that will long outlast his direct participation. There are few people better positioned to reflect on what his profession asks of us, teaches us, and gives back, and we are fortunate he is willing to share it. Please join me in welcoming Dr. Tarpley.
This is what I received from my wife this morning, first thing. So I'm just passing it along. Obviously, you've got Cinco de Mayo coming up tomorrow. So that's a huge, big thing happening around the world, as a matter of fact. It's truly an honor to be here. This is a little bit different talk. I'm going to do most of the global surgery talk at the 9 o'clock talk. But this one, everything I do is basically related to almost global surgery. Tom Routh is here, and I think that Ronaldo Dant Williams may be a trauma person out here, but anyway, it's good to have a couple of our Vanderbilt people who are on faculty here, and I'm grateful that Tom was able to come and we were able to visit yesterday. I could talk for several hours, but I'm not, so I'm just going to go ahead and get started. So these are some lessons learned in my 60 years in medicine and surgery, and I've added an interim report. My wife, I've elected to die climbing instead of to rust out. And hopefully that's going to pan out. I'm honored to be here. Dr. Naylor and I were associated back in 2010, and Don Meyer, my partner, now deceased, was here 2 years after me in 2012. So this is more of a philosophy kind of talk, and it's really aimed at everybody. And I will bring that up with one book recommendation. I maintain you in large part are what you read. But really for the residents as they decide how they're going to move forward. So some of the objectives that we talked about is I always ask the third-year medical students when they would rotate on what do they define as, how do they define a surgeon? And they said, well, they like to operate with their hands. They like instant gratification. They like to make a lot of money, da-da-da-da-da-da. And then that's one of the questions that I asked for objectives. We're going to distinguish career and vocation. And then we're going to talk a little about resume virtues and eulogy virtues. And so I have to have a question at some of the talks I go to. So one of the questions I always ask is, what do you want on your epitaph? I have no financial disclosures to report. I am a little bit hyperkinetic, nonlinear. There are no p-values or base pair substitutions in this talk, but mostly lots of unsolicited advice. I'm a bit of a hypocrite and a work in progress, and I say that because I give talks on the greening of surgery, and then I make 8 trips a year to sub-Saharan Africa, but my wife says those planes are going anyway. But we really have to worry about our grandchildren at this stage, quite frankly, I think, and that's another talk that I'll just mention in a brief. And so I'm going to be preaching a sermon, but I'm not going to take up an offering. So there's some wisdom literature. This is a talk I was asked to give at Vanderbilt in 1997. And some of the points of that talk, I will reiterate. Rob Riviella, who was here last year, told me that repetition was the branding iron of knowledge. I kind of looked that up, and there are about 200 people who claim that quote. But I will repeat myself intentionally. But one is, don't let your critics set your agenda. I think probably the most important might be get in the habit of having good habits. I think the getting is in the giving. And there's a verse in the Old Testament Hebrew Bible says, he who waters will be watered, and I add, and you can't outgive God. You need to love yourself and be your own best friend. A lot of people are going to try to put you down, but you need to love your neighbors yourself. And my granddaddy taught me a lot of what I know, and he used to say it's a mighty thin board that has only one side. So as a program director, I would have, and working at the VA, I would have people that would come and complain about a resident, but you needed to get the other side, because a lot of times what they were complaining about, he was asking them to do something because it was in the better interest of the patient. So you have to get both sides. Get more flies with honey than vinegar actually goes back to a monastery in Europe in the 1300s. And then keep your relationships in order. So first is, what is your definition of a surgeon? And you really can't be incorrect, because I asked you what your definition is, but I'm going to share mine, which I give to 3rd and 4th year medical students. And my definition is, as a surgeon is a physician who can operate when it's indicated and it's in the better interest of the patient. I think we are not, we're thinking people, and we're not just technicians who perform manual tasks and procedures and cover everything nights, weekends, and holidays so the other people can be off. I would argue that Perret is one of the 5 most important people in the history of surgery. But he said that surgery is an art which teaches by way of reason how by the operation of the hand we may cure, prevent, and mitigate diseases which accidentally happen upon us. And I think that this is still true. And it's not just about doing a technical procedure, as I will relate later. Now, many of you have been to London, and some of you will be going to London, and I encourage you to go to the Tate Gallery. But this painting from 1891 talks about where medicine was, a millennia ago or so. And so this is in the Tate Gallery. And so you've got a sick child, probably has a fever. You've got a mother who's distraught. They got a consoling father at the window. There's no electricity. There's a kerosene lamp. There's a coffee cup there. It's probably got turpentine hydrate in it to suppress a cough. And basically, it was all a ministry of presence and being at the bedside. And this was before X-rays and antibiotics and blood transfusions and all the things that we take for granted. So there's an obstetrician at the Mayo Clinic, died in 2012, named Ray Lee. And he said, never operate on a stranger. Now, if you're a trauma surgeon in the trauma bay, you don't have time necessarily to establish that close relationship, but you can with the family, but never operate on a stranger. So a couple of years ago, I was invited to come to Salt Lake City and present, and they had a change of program directors, and the new program director coming in said, is there a chance I can get an hour with you that we can discuss about some things you would recommend for me? And so we had that conversation, and I ended up writing it up, and I called it a TARP's Baker's Dozen. And a baker's dozen is like a 13th donut that they just throw in so you'll come back the next time. And so there were like 13 things that I said, though I cheat a lot because a lot of times there'll be a part A and a part B. So it could get up to about 20 and I can get out of control at times. But this relates to some lessons learned. So the number one thing that I think about every day as a surgeon, and even for myself, I mean, I've got some DJD, I've got joint issues and Dupuytren's and all that kind of stuff. Is that essential? I mean, do we really want to put a great expensive piece of prosthesis in your shoulder if you can still dress and you may not be able to play golf or tennis, but never could very well? So anyway, Art Brooks was an orthopedic surgeon at Vanderbilt. He actually graduated from Vanderbilt as a medical student, but between my first and second year of medical school, back when you weren't still going 12 months a year sort of, we had 3 months off. So three years, we had 3 months off, and I did orthopedics. I was manager and trainer of the Vanderbilt basketball team and trainer for the football team. So I spent a lot of time with the sports orthopedist and with the trainer and everything. So my wife has polio, so I was planning to go into orthopedics initially. And so this quote is probably one of the most important in my whole life. And all the residents at that time were men, but he said, boys, he just died recently, but he worked on a farm, he brought produce in, and he was just an incredible individual. He said, boys, there ain't no condition that can't be made worse with an operation. So I encourage my residents to stop and think, is this essential? Do we really need to do this? Do we really want to do this? What's the cost-benefit ratio? We use the term frailty now. So, I mean, I tell people I'm happy to spend a dime to get a dollar, but I don't want to spend a dollar to get a dime and have somebody around. So we mentioned Frank Spencer earlier. He was one of the speakers here previously, and he was a Vanderbilt graduate at about the age of 19. And he went to Korea, and he was with Blaylock, and then he was at NYU forever. But he said that surgery is 80% decision-making and judgment and 20% technical. Now, if you're going to be doing congenital heart operations, if you're going to be doing microvascular anastomoses, Ralph tears, you're going to be doing a lot of neonatal kind of stuff. That technical is really important. I maintain when we have people who might be interested in surgery, that if they can see pretty well and they can tie their shoes, they can probably do most things that most surgeons can do. But then I look around and they're wearing clogs and slippers and other things like that. So that's another concern that we can have. So I ask about a good surgeon and a great surgeon. I think you probably know this, but a good surgeon knows when to operate and a great surgeon knows when not to operate. And I would maintain that some of the most important surgical decisions that I have made were not to operate. Not everybody that has insurance or not has to be operated on. So a book that Top Knife, we've got trauma surgeons here, Denver's known as one of the trauma capitals of the United States as far as teaching and everything. But this is a classic book by Hirschberg and Maddox. And they may or may not be original with them, but that's where I learned it. But they said that good judgment comes from experience, and experience comes from poor judgment. And that is, if you reflect on it and learn from mistakes and unanticipated outcomes, then you can make progress as you go through your career. My granddaddy used to say that the only way not to spill water is not to carry water. And this comes to a topic I noticed, though, you had a slide up here about it. Have you had a bad experience? Are you experiencing some life difficulties, whether it's in the medical center or outside the medical center? There's help out there. But there's this term now called moral injury. And I like the term a cortical scar. I can't remember everybody I operated on. I don't even remember the ones that had great outcomes, but I can remember 5 or 10 people, especially, I wish I had another chance to do something differently. And I consider that a cortical scar, and you need to learn from that and not let that define your life. So we've got Sunil Geever-Geese is one of our transplant surgeons, and Heather Littlemoe is now down at MD Anderson. But the key, I think, is to try to stop the progression of moral injury. And so this is something that is Sunil's main interest. And this is a paper that talks about, can we mitigate moral injury and not let it destroy somebody's career? And you hear this term burnout all the time now. We have burn surgeons here, and there's different kinds of burns. But if you cut a common duct, or if you get an enterotomy, or you lose control of a major vessel or something like that, you have shame, you have fear. You second guess yourself. You have decreased confidence. You worry about your reputation. And this is where moral injury can come in. And it can lead to burnout if it's just kept quiet and nobody's discussed it and nobody sought any help. But if you will share, my wife says a burden shared is a burden halved. There are mentors out there, there are advisors, there are coaches. And the term we hear nowadays is resilience. So if you ask who was a major vascular surgeon in the 20th century, especially from Europe, you could get a lot of answers, but one of them is Lariche. And so Lariche, this is the 2 lines of Lyon. I was fortunate enough to teach history of surgery and medicine at Vanderbilt for many years at the medical school, but this is a tale of 2 surgeons. They're both from Lyon in France. Alexis Carrel won a Nobel Prize for the work he did, and he was a genius. He ended up being a fascist, but that's another story. But Lariche's syndrome, we all know about the aortic occlusion and the folks that would come in with gluteal claudication and things like that. But this was his paper in 1948. But he had a quote that I think is appropriate for us. He says, every surgeon carries within himself, herself, a small cemetery where from time to time they go to pray. It's a place of bitterness and regret where he must look for an explanation for his failures. Now, there's a neurosurgeon in UK who wrote a book and gave a talk, but he said, the more I thought about the past, the more mistakes rose to the surface, like poisonous methane stirred up from a stagnant pond. Now, Osler is an important person, and I encourage you to read the life of Osler. It's worthwhile, and especially Equanimitas, which is a collection of addresses that he would give. But he said that medicine is a science of uncertainty and an art of probability. We're not going to get everything right every time, and you need to go into it asking yourself, at least once you have a working diagnosis, what are 2 other things that are in your differential diagnosis? But don't just immediately have what I call a knee flex re-jerk. You need to stop and think it over. And that's a song, actually. So those are my points from the first point. So you can see there are like 10 things in point number 1. So I started my residency on July the 1st in 1970, and I was very fortunate to end up going to Baltimore. And Levi Watkins was my classmate at Vanderbilt. He was the first African-American to graduate from Vanderbilt Medical School. So we went up there together along with Phil Rosenblum, and this is our first day of internship. There are no beepers, there are no cell phones, and those have both changed a lot of our lives at the present time. But Levi, early on, like the first month or 2, he said, Tarp, one word of advice, you need to learn the names of all the OR techs and the orderlies and the cleaners. And almost every one of them were African-Americans. We were in Baltimore, and we lived in the compound and all that. And he introduced me to James Baldwin, and I'll mention Baldwin a little bit later. But one of the things that Baldwin wrote is that nobody knows my name. And I think it's really important to try to look people in the face, know their name, maybe write it down. There's a guy named Alex Howler who was a pediatric surgeon in Baltimore. But I was amazed because he'd go in and talk to a family and he'd ask them how the other kids were doing, and he had it by name and he knew where they lived and what sports they were interested in. It turned out he had a whole collection of 3x5 cards, and he would review that 3x5 card before he went in and saw the patient and the family. But it really set up a bond because they realized that they knew who we are and where we're from. They were not just, like I'll say at the VA, the hernia in bed 34, but the guy that's got the hernia in bed 34 may have a son in Vietnam, and that makes all the difference. So there's emotional intelligence, and you have good habits. You need people skills, and I maintain that you need to praise in public and critique in private. I had an attending that worked with us who basically desquamated one of our PGY4s in front of patients, families, nurses, and other people there, and it's just never forgotten. That guy has never forgotten that. And I didn't know my host was a burn surgeon, but basically the burnt child fears the flame. And we know that this is true. So we talk about hierarchy. We want to treat every resident, every coworker and student as though someday that person may be your boss. And actually that's happened to me several times. Walter Merrill was my resident when I came back from Nigeria to Nashville. He was my chief at the VA, and that's not the only time that that's happened. So point number 3, I would say that most of what I learned from Nigerians, and a lot of it was actually slogans on the back of taxis. But one is that no condition is permanent. Who of us saw COVID coming? And yet what a cataclysmic delta that has created. People now watch grand rounds in their pajamas from home, for heaven's sakes. You've got a really good crowd here, but mostly I think the medical students come for food at grand rounds for us, it seems like. But no condition is permanent. I was told today, if you don't like the weather, wait 2 hours, it'll probably change. Who knows tomorrow? We don't know that. We didn't know COVID was coming. And I'm not going to give a political talk today, but I think it's pertinent that no king is God is as appropriate now as when it was mentioned years ago. So I think that it's important to involve and include. Don't try to do the work of 10 folks. When I went to Nigeria, somebody said, don't come here, you got a good thyroid. Don't try to do the work of 10 people. Equip 10 people to do the work. So we want to equip, motivate, stimulate, and catalyze folks and help them have ownership and let them make progress. I'm going to give a talk a little bit later today, but when we are making relationships with colleagues internationally, we need to remember that it ain't about us. What are their needs? What are their desires? What do they prioritize, as opposed to say, I'm coming and this is what I'm going to do. We don't tell, we ask. And the goal is to create a team, and it's just not about us. And the Global South and LMICs, low middle income countries, have lots to teach those of us in the Global North and the HICs. I'll digress for just a second. I was able to give a talk at the International Surgical Society 2 years ago. They meet every 2 years. And I gave a talk, and it was on the greeting of anesthesia and surgery. And one of the examples I used was we had a visiting pediatric surgeon visit us in Abomashaw, and we did a replacement of the esophagus. And we left about this much suture on the floor, which all of my techs were pulling up and saving because they were going to re-sterilize it and everything. And I went to improve my skills doing vesicovaginal fistula repairs in Southeast Nigeria with Sister Ann Ward. Spent a week or 2 with her, watching her the first week, and then I started doing cases. She gave me one suture, and she said, this is all you get. So right now, we're a disposable throwaway society, and I'll talk about that. And actually, the people in SAGES are worried about that. Does every gallbladder, every appendectomy, every hernia have to be done robotically? Just think about how many red and black bags come out of every theater where they're doing MIS kind of stuff. It costs more money, it costs more time, and all that stuff is going to be with us for a long time because it's plastic and a lot of other stuff. And the device companies, Carmen Solorzano and her team at Vanderbilt developed a device where they could inject something and use a probe, and they could identify the parathyroid so they wouldn't take out 4 parathyroids when they're doing a major thyroid case. They got it ready to go. They got it ready to send. And the company said, unless the probes are disposable, we're not going to do it because it's not going to be a cost leader. If they buy one probe and use it for 10 years, we don't get any profit out of that. And we're not going to do it. But if they can throw it away after one use, then they can sell them repeatedly. And it's all about the money, as people say. All right. I think watering friendships, that's why I go back to Africa. When I was back in Nashville from 93 to 2016, I would go back to West Africa College of Surgeons every year. I'm a life member since like 1980. And I would go back to talk and visit with and encourage the folks who were following Don Meyer and me at Baptist Medical Center of Beaumont. So when I went there in 93, it was Baptist Hospital of Beaumont, then it was Baptist Medical Center of Beaumont. And now it's Bowen University Teaching Hospital. So now they've got medical students and trainees in internal medicine and family medicine programs. We didn't have enough diversity of faculty to have a residency program in general surgery at the time. So I think that watering friendships is really important. Jessica Gross writes for the New York Times, says, almost everyone needs community to flourish. And then from the Kern National Network, flourishing is not a solo endeavor. We need one another. So one of the things that I'll finish my talk with in the 9 o'clock talk is that it's really about relationships, forming relationships, watering friendships, relationships. We need partnerships. We need to persevere. We need to show respect, and we need to be humble. This is really, really important. I was fortunate enough to be a part of the Lancet Commission and spend a week in Bellagio on the lake in Italy and the launching in the USA and everything. But this is coming out of the Lancet Commission that was 2015, 2016. So my wife says these people don't know who Alfred E. Newman is, but I think there's some of you guys that probably do. But I maintain that when you can improve on silence, speak. And so the basic anatomy I want you to keep in mind is that God gave you 2 eyes and 2 ears and only 1 mouth. And I encourage you, when something comes up, don't do a knee flex re-jerk, but stop, count to 100, say a mantra that you like or something, take a deep breath, and then respond. But don't immediately. I mean, we got a guy named Domingo Pavia at Vanderbilt, and after he got 2nd place instead of 1st place, he almost lost his career in the NFL because he went ballistic and used the F word that went all over the flipping United States and even to other countries. You need to be careful what you say. It's kind of like archery. A word spoken is like an arrow that's shot into the air. It's really hard to grab it and bring it back, you know? It's just tough. So number 6, education. So education, I think, is something that you do as you go. You don't go to do it. And it comes out of the word from to lead. And actually, Mussolini was known as El Duce. And it's different from indoctrination and illumination. And it's actually different from training and education, though they're all like Venn diagrams that somewhat overlap. Now, my wife is a librarian, and she's a non-physician medical surgical educator. And I'll mention her later probably. But she talks about the principle of adult learning. And for her, it's like, what's in it for me and what's on the final? I mean, that's what people want to know in medical school and different things like that. And this whole concept of medical education and theories of medical education has been modernized to some extent. And we talk about, you've all seen this pillar where, you know, if you give a lecture, about 1/20th will be retained. If I just read a talk, maybe a 10th, audio visual with slides, maybe a 5th, demonstration gets better, discussion even better, practice by doing. And if I give the talk on a topic I don't know, I'm the one that benefits the most because I regreen myself, if you will, about that. So teaching others immediate use has the highest recall. And the reason they call it modern technical educational theory is that you can sum it up and say that if I hear it, I'm going to forget it. If I see it, I might remember it. But if I do it, I can understand it. The problem with that is this is from Lao Tzu in the previous 5 centuries before the Common Era. So this is one of my favorite quotes: how to teach and evaluate leaders. You can't learn to play the piano by going to concerts. You got to get your hands dirty. The simulation is really just taken off the last 20 years. It's really important. And I think that's important. John Dewey was a master educator of the 20th century. He said, we don't learn from experience, we learn from reflecting on experience. So I ask people, you know, finish this phrase for me. Practice makes, and never everybody says perfect. And what Dewey would say is practice makes permanent. If I go out to the driving range with a bucket of balls and flail about an hour working on my drive and nobody's there critiquing me, I'm concretizing my hook or my slice. I'm not necessarily getting it down the middle of the fairway, right? But if I've got a coach or somebody can help me, I may be able to get a few of them in the fairway. And this is Yates. Education is not filling pails, it's lighting fires. And that's what we want to do. We want to stimulate, motivate, and catalyze. That's my job description, frankly. I'm going to talk about Nelson Mandela later. If any of you go to Cape Town, I encourage you to go to Robbins Island. It was almost a life-changing experience for me. You have to book it ahead of time. There's a boat that goes out if the water and the wind allows. It was incredible. But he said that education is the most powerful weapon which you can use to change the world. This is a pulmonary medicine person. That's Beth Riviella's chair at the BID in Boston. But he said for any talk he gives, his goal is to challenge, to inspire, and inform. And we just had a former chief resident of ours who finished at MD Anderson, Keith Gray, who's now president and CEO at UT Knoxville. But he says, my goal as a servant leader is to equip, empower, and encourage. So this is something I've learned within the last month. So that's why I say it's an interim report. So get in the habit of having good habits. I mentioned that I'm going to repeat myself. I maintain that we're physical, social, emotional, sexual, relational, mentating, spiritual beings. We have to make sure we got a decent diet. We need to get appropriate exercise. I think you need to read something every day. You need to hoe your spiritual garden, and you need to be your own best friend. So my wife grew up on a farm outside of Burns, Tennessee, population 500. I call it Greater Burns Metropolitan Area. But her club was a 4-H club. And this is when I write recommendations for medical students or residents, whatever. I kind of use a 4-H format when I write the letter. So there's the head and the hands and the heart and the health. And so if you think about the head part, this is more complicated than just how well they can do on a standardized exam. I've got a lot of people that apply to Vanderbilt, and we would get just like y'all in the old days before computers, we'd get 1,000 applications. But I would read every word of every application. And then when the computers came, I had to get some help to do it because there's just too many of them at the present time. But there are a lot of them that got like 280s on their boards and all their exams and all this other kind of stuff. But that's just kind of what they can recapitulate and can give back to you. They've got it stored away in their brain. But I maintain that there's a difference between book smart and street smart. I want a resident who knows who's sick, who's not sick, who knows when I need to come in, I don't need to come in. If they need to go home, they need to be admitted to the floor, they need to go to the ICU, the imaging suite, or they need to go to the theater. So we were discussing one of our folks, and one of our leaders said, you know what, I've worked with this guy. He can score, he can answer any question I ask him. But the guy can shovel snow all morning and not get a path to the street. So again, we need to have book smarts as well as we have street smarts. All right, so hands are technical. I've already mentioned this. I maintain, if you can tie your shoes, you can do what most of us do. And that the hands are important, but being careful, and do they really need to have the operation in the first place? I think there's a heart piece, which is people skills, respect. How do they treat families, patients, nurses, custodial help? These are all important. And finally, health, lifestyle, have alcohol issues, drug issues, things like that. These are all things that I think are very, very useful. And it comes down in part, again, to terms that I didn't grow up with. So now we've got terms like emotional intelligence, encyclopedic knowledge, and those are two completely different things. But they're both important. I mean, you got to know something if you're going to be a surgeon. You don't have to know everything. And, when I was a medical student, I was one of these gunner kind of guys, and I had a biochemistry test, and I memorized a structural formula of neurominic acid. I don't know anything about neurominic acid today. I don't use that, and it's gone. But I knew it for that 1 hour, and it paid off. But emotional intelligence ain't common. You can say it's common sense, but it ain't so common, right? So number 9, I maintain that in large part, you are what you read. And I have read a lot of books by William Sloane Coffin. He was actually the model for the Yale chaplain in Doonesbury. But he's written a lot of good books. One of them, the Heart's a little to the left, but that's another story. But he differentiates career versus vocation. And he was a visiting professor at Vanderbilt for 6 months. And he came to our home. We just had a fantastic evening. But career comes from the Latin word for car or career. And there's actually a Porsche that's called a Carrera. And this is where it was Latin for racetrack. And it's where people went round and round and round in circles for transitory fame and glory. Vocation is like a priest or a nun. It's a calling. It's really what God would have you be, what you need to do, and hopefully to serve the common good. Not unrelated to that is this In Search of Balance by Virginia Mollenkott, who is at Virginia, UVA in Albemarle County. But she again says, keep your relationships in order, water your friendships, and be your own best friends. So these are two books that I really encourage you to read, and I'll have another one or two in a minute. But I was really touched by the visit to Robbins Island. I read his book, and there's actually a movie that you can see. That's a terrific book. And then the other book is that the Dalai Lama invited Desmond Tutu, who was a bishop, Anglican bishop who was in Johannesburg, then he went to Cape Town, to come and spend some time with them in his ashram in northern India. But Tutu had metastatic prostate cancer, and he had like 2 or 3 good hours a day. So what they agreed to do, Tutu and his daughter went to India, and they basically had an outside person interview them for a couple of hours each day, and they videoed it and they wrote it up. But the Dalai Lama and Desmond Tutu talk about the Book of Joy. This is really a good read. So one of the things that we mentioned were in the objectives and things was this idea of resume virtues versus eulogy virtues. David Brooks has been a writer for the New York Times forever, but he's now stopped and moved to New Haven, and he's with the Atlantic Monthly now. And he says, should you live for your resume or your eulogy? And what he talks about is, and we've known people like this, and I'm not going to name any names, but maybe they had chairs, they wrote books, they had been to every society. That was a great resume. But then they're divorced, the kids don't like them, nobody shows up to their funeral memorial service. I just got back from 2 or 3 days in Boston where Mike Zinner, we had a memorial service for him. He died of prostate cancer. He was not year behind me in residency program, everything. People from Hopkins showed up, people from Miami showed up, people from Boston showed up. He had been chair at the Brigham for about 20 years. But if it's all about resume, then sometimes folks don't even show up. Eulogy virtues were, he knew my name, he cared about me, he helped my career, da-da-da-da-da. These are different. So our speaker for graduation this next week is Arthur C. Brooks, and he had been in a think tank in DC from the dark side, I think. But anyway, in his midlife, as he was on a plane, he heard the guy behind him moaning and groaning. It turned out it was a 70-year-old surgeon, and he was basically commiserating because he used to be the surgeon, and now he was like Doctor Who, and that was his whole life was tied up in what he did in the theater and his administrative roles. And so Brooks, I'm not going to tell you the whole thing, but he talks from strength to strength. He says in the Indians and the Hindu, they have like 4 periods of their life. Maybe you have 3/3 of your life. And he says that the people that get the Nobel Prize have all those ideas and energy in their 20s and 30s, but they don't continue on that same trajectory. What happens is they have that first creative couple of decades, and then they have the reflective wisdom decades. And I recommended this to somebody yesterday to read this book, and it's Finding Success, Happiness, and Deep Purpose in the Second Half of Life. Highly recommended book. So some realities that we live with. Number 10, if something seems too good to be true, it probably ain't. And especially in this era of A1 and fake news and papers that are just completely fabricated, we need to maintain a healthy skepticism, but not exclude wonder. I'm not a statistician, but one of the quotes I like is to say that figures lie and liars figure, lies, damn lies, and meta-analyses. And again, it's a mighty thin board that has only one side. Now, Jeanette Norden was a neuroscience PhD at Vanderbilt. She won every teaching award in America. She was like not quite 5 feet tall and maybe weighed 90 pounds. But she says you need to teach less better. Hit the high points, cover the topics. We had an emergency medicine physician who won a lot of teaching awards, and he said 5 things. They can't remember more than 5 things. Bing, 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 bing. Corey Slovis, and he got a lot of teaching awards. So I'm giving you 90 thoughts, and if you remember 5 of them, I'll be happy. All right, so curiosity is really important. I like a real book. I'm not a techie, but I like to underline things. If there's a word I don't know, I like to circle it. Now with a cell phone, you can just go in and hit Zoom and get the definition of it and everything. But I like knowing what that word means and where it comes from. But curiosity is one of the permanent and certain characteristics of a vigorous intellect. So I get into some quotes now. So most people know Jonathan Livingston Seagull and all this kind of stuff, but Bach's written several books. One of these is The Illusions, but he says, if you argue for your limitations, they're yours. It's like the little engine that could. I think I can. It got over the hill. But if your initial thought is that we can't do that, we can't start a new burn unit here. Well, yeah, you can. It's going to take some work and some effort and some planning. You're going to have to convince some people. You're going to have to get some money. But yeah, you can do that. So there's a lady named Barbara Slowey who was our supervisor at the VAOR, and she was a wise woman. You need to learn from everybody. Those are your bosses, those you're working with you on the floor, different things like that. But one of my favorite quotes from her was, she said, the older we get, the better we were. Some of you might be able to identify with that. So Einstein, he said, not everything that can be counted counts, and not everything that counts can be counted. I like this one from the Hubble telescope. He said that visible light covers only 2% of the electromagnetic spectrum. Now, if you're from Missouri and said, I ain't going to believe it unless I see it, you may be excluding 98% of reality. You need to have some mystery and some wonder and look some things up and think about them. So Charlotte Whitten was mayor of Ottawa, and she was like, I think, the first mayor, maybe female mayor in Ottawa. And so she said that for a woman to get half as much credit as a man, she has to work twice as hard and be twice as smart. Fortunately, that isn't difficult. All right, so James Baldwin is one of my people now, and he says, not everything that is faced can be changed, but nothing can be changed until it's faced. Kobe was a Pole. He was a Jesuit, and he was opposed to the Gestapo and all that kind of stuff, and he actually got executed. But he said the most deadly poison of our times is indifference. And so we need our people. We need all people, I'm using all, to vote. If they don't vote, they shouldn't complain. So I'm a Baltimorean. I've spent a lot of my life there. And Mencken was a character. He was on the Baltimore Sun, and he wrote a book called The Carnival of Buncombe, which is Buncombe County, which is Asheville, North Carolina. But he said, I had a guy from Kerrville, Texas, a urologist, turned out to be terrific, but he came out to visit us and teach us how to do better cystoscopy, brought us some scopes, and he was really good. But after he had been there for 3 days out of 2 weeks, he knew how to solve every problem in Nigeria, of which there are legion. And I didn't even know what all the questions and all the problems were. But he had an answer for everything. But so Mencken said, for every complex problem, there's an answer that is clear, simple, and wrong. Okay? Now again, back, nobody ever drowned in sweat. I teach my people that work is not a 4-letter word, it's ergon. And we get the erg, which is a dyne centimeter, and ergonomics from that. And I've mentioned equanimitas before. And these are collections of addresses to medical students, nurses, practitioners that Osler wrote. He was actually born in Bond Head, Canada. His dad was an Anglican priest. Went to Philadelphia, came to Baltimore, went to Oxford. He was a Regius professor there. And so he talks about that the master word in medicine is work. Nobody ever drowned in sweat. The term surgery actually comes from combining cheer, and in French, a surgeon is a chirurgien, combining hand plus work. But we need to use our brains as well. So surgery is not an act. It's not a room. It kills me when these third-year medical students say, we took him to surgery and we surgerized him. It's like fingernails on a blackboard. I mean, you know what a blackboard still is. All right, so surgery is an art, it's a science, it's not a system of thought. And it is a system of thought. So again, you want to be your own best friend. This gets back, and it's been credited to Plato and to several other people, but it turns out it was a Scottish minister from the turn into the 20th century. He said, be kind, for everyone you meet is fighting a hard battle you know nothing about. So again, hammering this one thing, the power of nice is what my wife says. It's you need to be your own best friend. Love the Lord your God with all your heart, soul, mind, and love your neighbor as yourself. You need to love yourself. So here's Theophrastus. He says, time is the most valuable thing that one can spend. So my favorite art museum, and I collect art museums. Whenever I go to a place, I visit churches, cathedrals, and art museums. But Walter's Art Gallery in Baltimore, they have one room that they've got a lot of precious pieces in, and this is one of them. This is like a 15-inch statue out of boxwood from back in the 16th century. And it's a skeleton with kind of worms and snakes coming out, and he's got this scroll and everything. And the scroll says, I am what you will be. I was what you are. For every man, this is so. And so live in the light of your own mortality. Now, moving it into the 20th century, we all know this person. Covey was talking about the 7 Habits of Effective People, which came out in 1989. And number 2 is begin with the end in mind. Begin with the end in mind. Where do you want to be 5 years from now? Where do you want to be 10 years from now? I think this is all these are important. The sharpen the saw is a nice one to know about. And if you don't know about that one, you can look it up, or I'll be glad to tell you. So winding down now, believe it or not, what do you want written on your epitaph? So this is a guy, he wasn't my mentor. I think we overuse the word mentors. I think mentor was actually a parent in residence, if you will, when the father went off to fight the Trojan War and everything. But I think we have coaches and advisors and role models. So nobody outside of Baltimore knows who Dick Kiefer is really. He was like a tuberculosis chest surgeon, and he was at the VA. He helped build the VA in 1952, and he was kind of my main guy. And I got to know him, his wife, and his son was a medical student with us, ended up finishing residency at Vanderbilt. And I stayed in touch with him. I stopped by in Nashville whenever I could. And Bobby called me and let me know that Dick had died in 2008. So I called this guy, John Cameron, and I said, Dr. Cameron, I still call him Dr. Cameron. I just want you to know that Dr. Kiefer expired 2 days ago. Bobby called me, da-da-da-da-da. He had some health issues. And the phone went silent, which is unusual when you're talking to Cameron. The phone went silent. And then he said, he taught us all how to operate. He taught us all how to operate. That's a pretty good epitaph for somebody who's an academic surgeon. So Osler said, I desire no other epitaph than the statement that I taught medical students in the wars, as I regard this as by far the most useful and important work that I've been called upon to do. And then I go to Brackenhurst, Kenya, at least 4 times a year. We put on conferences for our FACS residents and trainees and fellows, and that'll be in the talk at 9 o'clock. So this is the father of the Lakey that is an anthropologist and set up the museums in Nairobi and everything. This is in Limuru, which is right out. It's in the Central Highlands of Kenya, just north of Nairobi. But this is his tombstone, and it says, "You live on in the minds you inspired, projects you pioneered and created, the lives you impact and created, the hearts that love you. Your influence will never die." So I'm kind of a funny bird. One, I'm from Jackson, Mississippi, and I'm a member of the Association of Women Surgeons, and I'm a member of the Society of Black Academic Surgeons, and I go to that meeting every year. And we were in Davis with Diana Farmer in 2024, and she gave a keynote address at that meeting, and this is how she concluded. This is her final slide. Our profit-centered medical industrial complex. 20 years ago, we talked about the military industrial complex, but now it's a medical industrial complex. There's great wealth, but not great health. I mean, we're right there with Cuba, like at 35 or 40 with total health, and our expenditure is #1 in the world. We need to touch patients rather than computers. I would say probably both and in this era. We need to commit to leading, not being led. And medicine should not be for profit, but it is a profit-centered industry presently, unfortunately. So this is a physician's prayer by Sir Robert Hutchison that was in the BMJ at the end of the last century. He said, from inability to let well alone, from too much zeal for the new and contempt for what is old, for putting knowledge before wisdom, science before art, and cleverness before common sense, for treating patients as cases, and for making the cure of disease more grievous than the endurance of the same. Good Lord, deliver us. Tom Routh and I were talking yesterday. There's an endocrine surgeon from Mayo Clinic. He's retired now. He's from Pretoria in South Africa. But I saw a video that he did, and he said he was in the theater for every patient of the 30,000 cases that he did, patients that he operated on, for when they were induced and had their anesthetic. He said, I was holding their hand when they got their anesthesia. And he said, that may be the most important thing I did, because they remember that, and it took away their fear, because I had the ministry of presence. And it wasn't like, call me when everything is open and all the retractors in place. He was there. What for the patient was really a critical moment or two. Final disclosure. I tell people, I said this first at the Baltimore Academy of Surgery in 1990 when I was back, because my wife and I, we got like support. We didn't really get a salary. We had a house. They provided a car, but we had to pay mileage and everything if we were doing it for social and everything. But I tell people that I am the best paid surgeon I know. I just get paid in different currency. My residents, my students, and my patients, they're non-taxable income. And having an hour and a half yesterday with Tom Routh is part of that, and I highlighted this trip. So if we think about the logo, which has recently changed from American College of Surgeons, it's to serve all with skill and fidelity. We don't do that in Nashville. We don't do that in North Nashville. We don't do that in South Africa, Southern Africa, and many of the places I've gone. And I think we are some of the blessed people on the whole planet. We are not special needs. We were not special needs children. Somebody really cared about our education. We were able to get into a good university, a good medical school, a good residency, and we've got a meaningful career. And we need to realize that and help other folks, lift them up, catalyze them. So these are my contacts. I'm very grateful to be asked back a second time. And thank you all very much. God bless.
Thank you so much, Dr. Tarpley, for your talk. Does anybody have any questions?
Dr. Tarpley, thank you so much. You've given us a lot to think about. It's a great way to, I think, approach the graduation season. As we get into June, all of our finishing house staff are going to go on to fellowships or jobs or careers, and there's so much packed into your presentation for us to think about as we get to the transition of the academic year and start a new one in July. But I want to ask you a question to give us an anecdote about one of your experiences outside of the country that you have brought back to your practice in the United States and implemented something different from what you learned in, let's say, the global South, as you said.
Okay, I think I'm still on mic and everything. I would say that there are several things. It was interesting when I would come back to Baltimore every fourth year. I think it's really important to still do a history and a physical, to talk to the patient. And we have a joke that basically says that a history and a physical is what they do in the emergency room when a CT doesn't give them the diagnosis. I think it starts with the history and physical, okay? And maybe not everybody has to get a CT every time. We're a disposable society. We throw stuff away. So what I found out is that you can't do this anymore, I guess. I mean, gastroenterologists don't even do rectals anymore, except if they're doing a colonoscopy. But I mean, I would examine patients and even do a rectal, and I would find stuff that they didn't know was going on, kind of a thing. And I think what they did, they would be ordering tests, and what I would be doing is talking to patients and examining patients. And I think that made a difference at the VA in Baltimore. I think financially it's an issue. This guy, Kiefer, he talked about, I think I got my job in part to Hopkins because we were on a pyramid at the time, because I went to the VA. And instead of buying expensive tape and everything like that, I got masking tape to put on the dressings of the wounds and things like that. It was clean. I mean, the other tape's not sterile. I mean, it's things like that. But he basically said, you can play a Steinway one time and throw it away and say it's a disposable Steinway. We throw so much stuff away instead of repurposing, recycling, and getting it to somebody else that can use it. I mean, you got all these blue towels and stuff. You can get them to the vets or something. You don't have to throw them in the garbage. And then we get this whole controversy about it. We're going to have cloth gowns, we're going to have paper gowns, but we're trashing the flipping earth. So I think that that's one of the things that I'm always preaching is about, you're thinking about maybe it's going to save you $1 here or something like that, but what's it doing to your grandchild? When we basically all the landfills, and you've all seen all these plastic islands in the Pacific floating across and things like that. This is not sustainable forever. We are crazy. All right, so that's one of the things, that's one of my pulpits.
So I have a question. So as you have a lot of residents, medical students, young faculty here that are listening, and you talked about sort of good judgment comes from experience, experience comes from poor judgment, and about the second half of life. Is there a way, I don't want to say a shortcut, but is there a way to speed that process up so that we don't have to go through quite as much poor judgment, and can get to that second half of life where there's more satisfaction or more that you can contribute?
Okay, I think small groups are really important, like a cadre of friends, whether it's a Bible study or a sports group or something like that. Right now, there's a guy named Najib Boomrod, who's one of my best friends. He's got an incredible story, came from Lebanon. But he and I meet with one of our colleagues who's under a lot of stress and pressure because he's supposed to be running all the things in the OR, and everybody wants more OR time, and the neurosurgeons want us to bump elective cases so they can add their emergency to it, and he's just in fire all the time from every direction and everything. I think having a few people that we go to a double dog in Hillsborough Village, and we'll get a glass of wine or a glass of beer and talk for an hour, hour and a half, but it's like a closed circle with 3 people that's totally confidential. I mean, neither one of these guys are priests, for heaven's sakes, but I mean, it's like you're going to the confessional and you've shared it. So again, a problem shared is a problem halved. And I think that that's really important for me. And I've almost always had that person. In Nigeria, it turned out to be Nigerians. And one of the things we would tell our residents when they go, make at least one friend who's not in the U.S. West, Great Britain community, but somebody that will actually be honest with you, because their first thought oftentimes is to say what they think you want to hear. And you know that. I mean, you've been going to Rwanda and everything. So the bottom line is find a few people. And again, there are a lot of things that are really important. Who you marry or who you couple up with is really one of the big decisions of your life. And I told my sons, I said, I think I won the marriage lottery. That's what I want for you. That's what I want for everybody. But we know that ain't true. But my wife and I are like Team Tarpley, and I'm going to talk about her more in the other talk a little bit. But who you marry or partner with is really important. But having friends that you can talk with that stays in this room, I think is really important.
Any other questions for Dr. Tarpley? Well, great. Thank you so much, Dr. Tarpley, for all your knowledge and all your everything you shared. For all of our visiting professors, we have a gift with some ties and some other things in there. And if anybody's available, he will be talking at the Global Health Forum at 9 a.m.
Yeah, and I'll be there till 5 o'clock. So if anybody wants to talk, I'm a talking dude. Thank you very much.
Thank you. He's right there.